This has been a terrific discussion, and we are going to continue with a second panel that I'm sure is going to be as good as the first one, that will be moderated by also my friend and colleague Alessandra Guedes, who is the Regional Advisor on Family Violence at the WHO Regional Office for the Americas, the Pan American Health Organization, PAHO. Please, Alessandra and the panelists.
So good morning, everybody. It's really a pleasure to be here with you today. The format for this panel is going to follow the same format as the first one did. And for the sake of brevity, I'm not going to go into the distinguished bios of everybody who is here. But briefly, I'm joined on stage by Amy Banks, who is the founder of Puntos de Encuentro in Nicaragua, and also the executive producer of the TV series Sexto Sentido en Contracorrientes, and by Laurie Michaud, who is the co-founder and co-director of Raising Voices in Uganda, and finally by Rajiv Rimal, who is the chair of the Department of Prevention and Community Health at the Milken Institute of Public Health here at GW. And I just want to say, you know, as I was listening to the panel this morning, how honored I feel to be here, because I've known many of these folks for many, many years, and still, whenever I hear you speak, I always learn so much from you continuously, so it's really a privilege to be here. And I want to start with my longtime colleagues and friends, Laurie and Amy. And Laurie and Amy, both of you co-authored the article Prevention on Violence Against Women and Girls, Lessons from Practice, which I must say I enjoyed reading very much. And I was talking to Amy before the panel that I think what I liked a lot about the article is that it addresses these out-of-box ideas and innovation and creativity, but in a very systematic way, in a very logical way. And so as I read it, I kept thinking, oh yeah, I think that too. I think that too. But I could never have put it in writing the way you did. So encouragement to everybody to go out and read the article. And both of you have spent a substantial part of your professional lives working to prevent violence against women and girls in very different parts of the globe. And I wonder whether you can share some of your experiences, the experiences that you based the article on. And maybe, Laurie, we can start with you.
Sure, thanks, Alessandra. And I also agree every time I come and I hear our colleagues, because we don't always get together very often, and it's always really great. So thank you all for coming. And Amy and I did co-author with other colleagues this article in the Lancet, which was really exciting for us because the Lancet asked non-researchers and non-academics. So we actually had an activist voice in the Lancet, which was very exciting, somewhat intimidating, but it was great. And it allowed us to concretize some ideas that we all work with all the time in terms of our own on-the-ground work. And so the beauty of it was that even though we don't, Amy and I don't work together on a daily basis, and neither do our other co-authors. Jessica Horn, who plays a very active role in the feminist women's movement in Africa, and Malika Dutt, who is the founder and director of Breakthrough, and also Kathy Zimmerman, who's worked on trafficking for a long time at London School of Medicine and London School of Hygiene and Tropical Medicine. And so we sat together and really tried to put down a lot of our collective experience into this article. And when we were developing it, we too thought, oh yeah, we got to do that one, and we got to do that one. And we kind of had to whittle down our laundry list, because we had kind of a laundry list at the beginning, because we have learned a lot. And it was really encouraging to feel like we have come very far. And so I think Amy's going to start a little bit talking about, we're not just like the other speakers, we're not going to go detail by detail through the article, because you have it. But we wanted to kind of show a little bit evolution of some of the work, and then some of the real practical, okay, what does this look like with real people? And so that's what we'll kind of spend a little bit of time doing. And I think Amy's going to start and talking a lot about just what does it mean to develop effective strategy.
Thank you. Thanks for coming, and thanks for inviting me. It came up from Nicaragua for this, and I'm very pleased and honored. And because we're on a university campus, I just wanted to acknowledge that my activism started when I was in college. I'll date myself in the late 70s, and doing Take Back the Night marches on campus. And it did actually have an effect of lowering assault levels, and I have to say I'm sorry to see that it's such a major problem again on campuses, and I hope that it's getting the kind of organization that it needs to mitigate that again. But so these things do take a long time to solve and don't get solved forever. They have to keep being worked on. So like Lori said, we were a bunch of activists who then began, each in our different places, and who then were developing programs and strategies and then theorizing and kind of systematizing what was working and what wasn't, and evolving our work on the basis of that. And then we came together with this article, which was a great place to put that together and to see how things that were going on in very, very different parts of the world had a lot of core things that were similar. And some of those were mentioned in what Lori presented and in what Mary talked about. So I want to talk just very quickly, since we're going to go from all of those general things to get very specific about our practice. And so I'm going to talk about the organization that I work with, which is called Puntos de Encuentro in Nicaragua. That means meeting points or common ground. And it was started by feminists who had been very active in the Sandinista revolution in Nicaragua in the 80s, and who felt that despite all of the formal gains for women in Nicaragua, that there was still a tremendous amount to be done about the culture of machismo and violence that were, millenniums of patriarchy, but also a legacy of war and authoritarian rule and dictatorship. And so there was a lot of stuff to undo and to figure out how to transform all of that. When in the 90s, when there was a change of government and the war ended, there was the ability for the women's movement to basically start with its own agenda and realizing the issue of the personal is political and the political is personal, and that what happens in the most intimate realms happens in the most public realms and vice versa. And how are we going to get that all aligned? And that it required the transformation of power relations and of gender roles and things. And we also realized that these kinds of changes don't happen by decree, and nor do they happen just by the implementation of, or by having laws and policies, if there is not actually from the people some interest in those things happening. So it required an amount of cultural change in what is thought of as normal, and kind of what the discussion that is happening in a society is. And we had to get behind what was holding all of this up, and also how people are living these kinds of violence and oppression. And so the question of how to do that was that we needed to have other kinds of messages going out. So example, if you talk about family unity, often the family unity or family values is keeping women and kids in their place. And then we wanted to talk about family unity as a place where families and homes are safe places of mutual respect. And the concept of respect, which is often used as respect your elders or show some respect, and respect means obedience and not mutual respect, we just said we have to start putting out these alternative ideas. And so the kinds of things that we were doing of kind of deconstructing that discourse and reconstructing some alternative through a lot of the kinds of things that people have been talking about here, of the community mobilization and workshops and promotion and campaigns of getting things on the agenda. We got to a point where we thought, well, we need to actually have a little bit more reach, because doing things in all local levels, we get to those people, but how can we get it into the bigger picture? And one of the ideas that we had was to be able to do a TV show. And some people have heard of the TV series that we have done, but which was not just designed to be TV series. It was designed to take everything that we had learned and put it into a way of getting organizations involved in the beginning, the middle, and the end of having it on the air. And I'm going to show, we've done a couple of these now, and I'm going to show a very quick clip just so that you can see kind of how it works, and then we will go on. So I don't know if you can see it with me, with us in the way.
Jessica, te presento a don Sergio.
Hola. Reinaldo me dijo que eras nueva.
We're making TV drama in Nicaragua, not to get to Hollywood, but to make a difference and to get into the hearts and minds of millions of viewers.
Por favor, tenemos que tener mucho cuidado en quién confiarnos, no solo los desconocidos pueden ser proxenetas.
Alerta a las adolescentes, entonces una prevención.
What we're trying to do is help women and girls be able to break the silence about violence at the same time that we're trying to shift public opinion and perception about who's responsible.
El socio de Richie y los maes que la violaron, esos son malos, deberían de estar presos.
We're part of the women's movement, so we connect this, the reach of mass media, with collective action for women's rights.
Just if you want to see the whole thing, there's the Casa Kamakaye TV has the whole documentary, which is a documentary about this work, and you can see the episodes and things and how it all comes together with the organizational work. And just to say that you saw one of the themes, but what we ended up dealing with was a lot of the things of the economics and how that plays into violence, the secrets around sexual abuse in childhood and how that plays into the generational thing. And so there was a lot of different issues, but it was also, there was humor. It was not all, corta pulsa, we say in Spanish, of tragedy. But I want to now, this is just one of the interventions, and I want to talk now, hand it over to Lori, who's going to talk about how, as you begin to develop these kinds of strategies and put them into action, and then the lessons learned as you do it, and how you then continue to develop. So, take it away.
Yeah, so thanks, Amy. So I work with an organization called Raising Voices. We're a feminist organization based in Uganda. And what we decided to do in this session is to not really talk about our approaches per se. There's other people have mentioned Sasa this morning, which has been nice. But I'm going to talk just a little bit more broadly about so what. And when we're doing prevention work, our goal is not to say, okay, use stepping stones or Sasa or different approaches all over the place. But what's core about some of these approaches? And so we're going to show a little tiny film as well, and then I'll just talk a little bit about some of those key points. And I think I'm going to shift because it's in subtitles as well. Sorry.
Kati olubereberye nali ntyanga simanyi nti nange nsobola okuba n'obwenkanya oba nsobola okuba n'amazima. Buli lunaku nze nalowoozanga nti nze njogera ekikyamu, nti nze nteekwa okunenyezebwa buli kintu. Naye Sasa bwe yajja yampa amaanyi, empa obuyinza. Teyangabira buyinza kuba obuyinza olwedde nze nali mbulina naye nga sibumanyi. Wabula kasita yandagirira enkozesa n'enkolagana ebanjigiriza okwagalana n'okukkaanya. Kikulu kukkaanya. Okukkaanya okwo kasita nnakuyiga. Tinteekwa okuba n'obuyinza bwange nga nze ate tulina kuyita mu kukkaanya tusobole okubeerawo.
Enkole neekyusiza bw'eti nti luli bwali bwange. That was power over. Nga nze nina power nzekka. naye okuva nayingira mu sasa namanya nti there is power within era tubugaba n'obuyinza era sibeera nkawo ne nenyumirizaamu nti nsobola okuba n'obuyinza nzekka ndagire nsalewo wabula mala kwebuuza nti munnange kino kinaatukolera kisaanidde kyasiima kyetukola.
Nze ng'omuntu sasa nkyusiza endowooza yange ku bakyala. Mu kusooka nali mmanyi abakyala balina kubeera andabaami mu buli nsonga kuba kati bwe tuva mu maka gaffe gye batuzaala tufumbirwa. Bwe tufumbirwa buli kimu olina kubeera wansi waki wa mwami. Twesanga nti buli kimu olina kukolera wansi wa mwami, omwami taddibwamu. Omwami kwegamba olina kukola ku kyakugambye, bw'aba yaggaana okukola tuula, buli kimu bw'aba omala kumusaba ogendako ewammwe teweewaggula. Kati twesanga nti twaddiranga ebyobuwangwa lusi ne binyikiriza obulamu bwaffe naye nga mu butuufu
So, just as an example, to, I think, ground and remind us first and foremost that the work is about people, regular people, and that people have to really remain the center and the core of what we do, starting from ourselves and our own staff. Often, we do programs and we think, okay, we have a project time frame and we have to hire people and they've got a month or, a week to get trained up and then they're going to go out there. And they haven't had a chance to have their own sort of critical reflection about issues of social justice and power and equality within their own lives. And yet we expect then for them to be able to go out and do this organizing in communities. Same as community activists. These are activists, just regular people living in the community who then, as Mrs. Bukenya said, she didn't even think she had it. But then she was very close. Sasa didn't give it to me, right? Which is great because that's about her, right? That's about her and her own realization. But often our programs don't help people go through those processes. So I think fundamentally within prevention, people are at the core. And I think we have to really remember that in our programming and how we do our programming and even in the language that we use. They're not targets, they're not beneficiaries. It's really about people and starting there. And that their lives are complex, right? And our programs then necessarily have to be complex. Our lives are complex in the same ways, and we have to really help people and our programs wrestle and be okay with that complexity. I think the second thing that I wanted to just mention and that we put in the paper as well around this intersectional gender power analysis sounds big, but what it really means is that we need, when we do violence prevention work, to have a compelling and tangible and personal analysis of the issue. And I think for a long time, our work really, we would talk about violence in the community and we would kind of promote rights broadly, but it was very hard for people to feel like that was about them and that touched their lives. So instead of using language around equality and gender, we started talking about power. And it was like, oh, I might not self-identify as a woman who's being abused, but I know the feeling of feeling a lack of power, and so do men, right? So instead of having men think about, oh, I have to go to this session on violence against women, which basically you're not going to get anyone, is then to be talking about power, and especially in communities where we work, where there's where men have very, very few opportunities to feel a sense of status and power. I think the other is that prevention is really not random, right? We often think prevention and we think, okay, it's a little drama over here and then we're just gonna do some posters and then maybe we'll do a rally during 16 days. But that's really not prevention. Prevention is systematic and structured and based on a theory of how we expect change to happen. And unless we have that, then it's very difficult to actually have that change come about. So really being theory informed and having an idea of how we expect things to unfold. And then working, as Lori and Mary were also saying this morning, and Amy's work really reflects this as well, is not just working with a small group of individuals that we might pull from a community and go through a training with them, but really at a broader level to affect broader norm change. And I think the last one I just want to mention is really around how we frame our discourse around this. That it really, if we think about how we change as people, that we need to see that there's some personal benefit to it and that there's hope, yeah, that we can actually make some change. And a lot of our programming and a lot of our messaging around violence is not very positive and not very hopeful, and yet that's a fundamental of what we need. Any human being needs to be able to change, and our programs can be better at including those and really helping people see that there are benefits of change. And we talked about some of these kind of key broader principles in the article, and we didn't list all of them now, but there are, it's really encouraging to see that there are, you know, whether I'm working in sub-Saharan Africa or Amy's in Mesoamerica and Malika is in Asia, there are very, very common lessons that we're learning about how to do this violence prevention better. And I think that that's really hopeful for the field, and that we can put it out there so that more and more we can build and learn from each other around what works.
Thank you both. Thanks, Amy. Thanks, Laurie. And Laurie, your comment is a nice segue into the question that I would like to ask you, Rajiv, because your work precisely looks around changing social norms, particularly to improve health outcomes. So I wonder if you can talk to us a little bit about what experiences and lessons learned from your own work and from theories of behavior change more broadly that you think would be particularly important for those of us who are working on the field of preventing violence against women and girls. And in particular, if you can talk to us about some of the lessons that you see reflected in what Laurie and Amy have shared with us just now.
Sure, I'm happy to. But first I want to thank Mary and the entire team for this wonderful opportunity, for hosting this wonderful event, and for inviting me to be a part of this. I'm learning a lot, and you know, as every time I hear the word norms, it's music to my ears, because that's what I'm kind of steeped in. I have a small presentation I'm going to get the clicker for that I'm sure is not as entertaining as the two videos we just saw. It's a boring PowerPoint presentation. But I wanted to talk a little bit about, to address your question about norms, normative change, and behavior change. I think one of the things that we've learned is that many of the behaviors that we really care about are deeply entrenched in traditions, in social practices, and asking individuals to change as individuals is swimming against a very powerful current. And that's asking a lot to do of people. When we think about changing social norms, sometimes which is very difficult to do, you know, every other week it seems we hear some story about some incident somewhere in the world. And for many of you plugged into the social media, you know that this past weekend there was a huge incident in India where two very brave women accosted three men on a bus, and the whole incident erupted on social media within just a few minutes. And that in some ways may signify a change in norms. And you know, when we talk about norms, I keep thinking about what would happen. I'm going to use examples from tobacco, if you don't mind, because I think the ideas are still the same. What would happen if I had a burning cigarette between my lips and I was walking down the metro in Foggy Bottom? I would get slapped down immediately, right? And I would know that it is just not tolerated in that environment. And people would let me know about that immediately. And you know, that's a long way that we have come from images like these. And one of the things I think that we don't think about very much when we talk about normative change, particularly in tobacco, is that these norms did not change overnight. That it's not as if, you know, we woke up one fine day and smoking was not allowed anymore. Oh no, there were a lot of things that happened You know, there were scientists working to show the link between cancer and tobacco. They were fighting big tobacco. The Tobacco Institute, many of us know, was an organization just created to try to debunk all the scientific evidence that was coming out. There were government agencies that were involved. There was public policy that was being implemented. You know, there were public relations efforts that were undertaken. There were international, national NGOs that were really invested in changing norms around tobacco use. There were public health scientists. Stan Glantz from UCSF was one of the key players in really showing how big tobacco was manipulating the evidence and raising awareness in the scientific community to change those kinds of norms. There were public health departments from around the country that were invested in this cause, raising awareness, changing, enhancing education. And then, of course, there was support at the legislative level. Probably no other human being, at least in this country, that has done more to reduce tobacco use as Henry Waxman from California. So all this to say that, you know, it really takes a community with a capital C to show the impotence of tobacco use. And I think for me, as we sort of used similar kinds of ideas in violence against women and girls, the question that, you know, I have is, where have we reached that inflection point, what mathematicians call the inflection point? Have we reached that critical point in the trajectory of violence where we then say no more, right? Where a young girl feels empowered to say, no way, you're not going to do this to me. Where, and you know, one of the fascinating things about that story about India that I was referring to was that the social media erupted not so much because the two women did what they had to do, but rather because people throughout India said, how dare those people on the buses stay silent? It was really about that uproar around the fact that people weren't doing anything. And so my question, I guess, is, if that is the model for tobacco, what are the norms that need to change for our issue in violence against women and girls? And you know, here are just some, and I think all of us have touched on some aspect of this throughout our morning sessions, that, you know, we won't accept the status quo, that we all have a role to play in this. It's got to be a comprehensive, and I think the evidence that Mary was presenting in the morning shows this, that, you know, if you engage just one sector, it's not going to be effective. We need the mobilization of the entire community from all sectors, and that if we all bring our collective efforts together, these norms can be changed. And I think lots are already happening, and I just want to point out that even at the political level, you know, what issue would bring Kirsten Gillibrand and Ted Cruz together? But they have been brought together, and I think we should really capitalize on that.
Thank you so much. And I think that, you know, as you're talking, I was thinking how those of us who've been working this issue for many years, we want it now, we want it yesterday, you know, but at the same time we have to understand the millennia that have gone into these norms that we want to change and how complex that is. And the next question is for the three of you, and I think that both Raising Voices and Puntos de Encuentro are really at the forefront of the kind of innovative programming that Laurie was mentioning that we need now, and that really it's quite incipient in terms of the development of the field. And both of your organizations have really pushed very hard for very rigorous scientific evaluations. And I'm wondering both what led for both of you to be motivated to seek that route, and also an issue that the first panel this morning touched on. How do you feel about the current state where the field is being very much pushed towards this impact evaluation and very rigorous evaluation? So a kind of a two-part question.
Sure. So for us at Raising Voices, the push, we were fortunate in this way. The push really came from us, from inside. We didn't actually have donors who said, you know, they would have liked it, but we didn't feel pushed into it. We really felt like as our organization, our role is not to kind of go and directly implement in communities all over the place, but actually to develop the how of violence prevention. So we develop methodologies that then other people can use and other organizations can use. And in doing that, we felt a real sort of anxiety about then other people taking it up and using it, because we had small scale studies, we had a lot of qualitative work done, but we didn't have kind of more rigorous results and data. And so we really wanted to do that, and we were fortunate to partner with the London School of Hygiene and Tropical Medicine on a trial. And yeah, lots of lessons learned within that. It's not for the faint of heart. That's first of all. But I think, and I have mixed sort of feelings about it. I'm really glad that we did it. We learned a lot. Our organization is really different now because of it. We learned a lot about research. I think for so long as an activist organization, you feel so disconnected from, that world. And this research wasn't that just London School came in and set up something and did it and left. We were really in the trenches with them and did it. And while that was very heavy on our organization, it also meant that we learned a lot. But I do think that our model, and a lot just similar to Amy's model, the whole idea is social diffusion. And a whole trial is like containment, right? So like fundamentally, it's really tricky, right? And so we actually had a really hard time practically, because activists would say, but I got invited to this and I want to go here and I found out this is happening. And at the beginning we thought, well, do we tell them no? And we couldn't. You can't tell them no, right? But you hope they're not contaminating. You start using really bad language, right, when you're thinking about people. But yeah, we had a lot of struggle within that, and how to have, kind of a control communities that we could measure against. And so I think that it's really important to figure out better, different methods that are also can be considered legitimate and rigorous, but then really are more sort of in line with the kind of work that we do. And I think Mary was saying it this morning too, but one of the most critical things that I think is we have to start bridging these two communities, because so much research is being done and people on the ground doing the programming don't read the Lancet. We just don't. Even for us as we were talking about writing the Lancet article, we thought, uh-oh. And you have to, it's not our kind of go-to journals, and often you don't even have access to a lot of the academic literature. And so trying to figure out ways of getting the learning from this kind of very formal academic world into the other world, I was going to say real, but that would be bad. The other world of really, like, what does this mean? And I really think more popularized reports around this data and what it means, as well as really, maybe even sections within academic and peer-reviewed journals that say, so what? What does this mean for programming? Here's 3 things that this means for programming. And actually, having that as a standard in journal articles would be, trying to figure out ways in which we can balance. Yeah.
Well, I won't repeat a lot of your experience. We had as well. We actually had been a little bit pushed into doing it by people who said, well, if you really want to show that what you're doing is effective, all of the other evaluations that you've done are too soft. Yeah. You need hard numbers that are going to be able to be published and stuff. And so we said, okay, well, we'll try that. And we were also lucky to find very good colleagues to help us do that. But we've also found that it was incredibly difficult to figure out how to measure changes in social norms as opposed to changes in attitudes, and how to figure out how to see what was going on in communities as opposed to at a population level. And that is very, and then there was a mandate to do behavior change analysis. And we knew that our kind of intervention, especially something like a TV show itself, doesn't do behavior change. But what was very useful about doing is we did what's it called, a pathway analysis that ended up being able to show that the theory of change that we had around communication and self-efficacy and all of that kind of stuff actually did work. And it's not direct cause and effect. There are pathways that people go through, and we were able to show that actually was relevant. In terms of, I know that we have not very much time, but in terms of so it did help, and it was kind of like, okay, we've done that. It was really hard. Mary was involved and knows how difficult it was to design and to implement. But it actually did also change things. By having that publication, it made things different. But we probably will not ever do that again. We figured, like, we've been there, done that, and now believe us, and when we do the other things, it'll do it. In terms of the evidence base and what we were saying, I totally agree with what Lori said before, which is that to not get straitjacketed into going straight to impact evaluation as the way to know what we should then next do, but also take the importance of formative research and knowing what the drivers are to be able to innovate and create new things. And if the funders who way back when hadn't taken a chance on what we were doing when we said that we wanted to do it based on a track record of community work and interventions and say we want to see what we can do next, it never would have happened. And they didn't ask us to do an impact evaluation when they did the seed funding.
I guess I'll be brief. I see that we're sort of out of time. I guess I would, just to reinforce what you're saying in a slightly different way, I guess, is that violence against women and girls as an issue, if we look at it external to people's lives, then yes, it will seem disconnected. But I've done most of my research in HIV prevention in Malawi, in sub-Saharan Africa, and even though I'm not a researcher steeped in violence against women issues, I bumped up against it everywhere I went, in HIV, right, in malaria prevention, in any kind of prevention, because when we look at it from the perspective of health and well-being, which is at the end of the day what we really care about, then this issue is an issue that cuts across no matter what topic you're talking about. Because when you're not able to contain violence, you're not going to have health and well-being of the populations that we care about. And then the other thing I want to say is that what we have noticed in our work in Malawi is that every time we collect data, we translate it to Chichewa and then take it back to the community, and sharing that data with the community in itself is an intervention. And we can say to them, here's where your community stands, and compared to your neighboring community, here's how you guys are doing, right? And that informs us, it informs them, and that's, I think, a true model of research to practice and practice to research, one reinforcing the other.
Thank you. And I know that we're running a few minutes behind, so my last question, you're going to have 3 words each to respond. And so there's a lot of new evidence and data that's coming out in the field of violence against women, and a lot more that's around the corner. Can you tell me in very brief words what's exciting you now? What's making you think, yes, we're getting there? I'll start with Brigitte.
For me, I think it is the idea that, what I was just talking about, that this is not an isolated issue, that this is an issue that touches upon populations, generations, and the entire society. And so if we're thinking about the health and well-being of people, and that's the lens that I would want to use, as opposed to, I work in malaria, or I work in HIV, or I work in violence against women. It's all one issue, which is what we really care about, which is the health and well-being of our population.
Thank you. Ari?
Yeah, the multiple outcomes one I feel very strongly about as well. I think for me, though, too, one of the most exciting things is the recognition that we can work at a broader level and we can work with communities, and it's not this impossible thing that will take generations and generations, but we're doing it and we're figuring it out, and that's really encouraging to me, and that we aren't working just with men or just with women or just with healthcare workers, but we are working more holistically, more and more, and that the recognition that that's important is more accepted now, which is exciting.
Amy?
Well, to add to that, I would say that the fact that, violence against women and girls is now really on the public agenda internationally, and the fact that there are such fantastic and smart people thinking about how to move it forward, and they were sitting right here and here, and being able to push it beyond the silos that we often have been working in, and saying context is important, drivers are important, gender is important, all of these things, and bringing it all together and figuring out how to move forward innovation and creativity and take what's working and be able to build out from there. So there's a lot of creativity that's going on that I think is really great.
Thank you, the three of you. And before we open up for questions, I just wanted to mention a couple of themes that have been running across the two panels, and I think one of them is this idea between collaboration between researchers and practitioners that has been exemplified this morning between the two panels, and the idea of translating research into very practical policy and programmatic implications. And I love the way that the call to action looks, and because it's very palpable and very easy to understand. I think also the idea of breaking these silos, that it's not violence, it's not malaria, it's not maternal and child health, it's everything, and it's the ultimate outcomes that we want to address. And this balance between promoting innovation and creativity, but building the evidence base and doing rigorous evaluations. And then thinking about Diana's question this morning, which was, can low and middle income health sectors afford to do this work and to address this issue? And I actually flipped that question and say, can we afford not to, right? And so I know that we're running a few minutes behind, and I apologize for that, but I do want to give you an opportunity to ask a few questions. So with your permission, we'll go just about 10 minutes, and I'll do the same thing that we did for the first panel. We'll take 3 questions. Please be very brief in your questions, and then we'll turn over to the panel. We've got one question over here.
My name is Kathleen Barnett. I'd like to ask Lori about the SASA program evaluation. I had heard maybe 2 years ago that the London School of Hygiene and Tropical Medicine was doing a rigorous evaluation. I was so excited by that because I really had great admiration for the program and was sure you'd have results. And I see in the first paper, unfortunately, that the results are not significant. Could you comment on that and maybe say a little more about how some evidence that could be used to prove that this could be scaled up and used elsewhere might be found?
Thank you. We've got one question.
Hi, my name is Kendra. I'm at Futures Without Violence, and the question I have is really about systems. I know the earlier panel was talking a little bit about systems, and so looking particularly at the videos that both of you shared, which were fantastic, the question is, to what extent, who really plays a role in sort of producing that kind of programming, and is it something that you do with and with partnership with, say, a government institution in the home country where that video is being produced, or is it really an outside NGO or outside group that comes along and says, we have this idea and we're going to implement it? And what opportunities are there for kinds of collaboration within systems to produce more videos like that?
Thank you. One more question over here.
Thank you for 3 really fantastic presentations. I was wondering, from the 2 programs that you described, and given the fact that you're not, you are real practitioners on this field and went through different kinds of impact evaluations, but are not coming from that perspective. Could you share to what extent do you think the results of the impact evaluation were really helpful and fundamental in shaping or changing in any way the type of program that you had already envisioned?
Thank you very much. I think I'll stop here and turn it over to the panel. So we have 2 questions on evaluation and one question in terms of the process of getting to the programs. Maybe we'll start going this way, Amy.
Okay. Well, in answer to the second question there, the way that it's a local NGO, so it wasn't an outside NGO coming coming in, and it was very much steeped in the women's movement and networks that we were part of that this initiative came out of. And so it was not, the government was not involved at all, and in fact, we are happy to report that we are able to coordinate with the government, but we don't take direction from the government, and in fact, it's better to not be part of a governmental program when you're doing community change, and at least where we work. And so it was very much, but we work with the health system, work with the education system, we work with the police and the justice system to work all of these things out, because part of the thing, for example, in the stories that we do is, how are we going to deal with the issue that the justice system is often an injustice system? Well, we want to push the justice system to be better, but if we show it as working, people say, well, that's not real. If we show it as completely broken, then our system disidentifies with. They say, well, all you do is criticize us. So we had to work together to figure out how to make the demand from the population work. So there was a lot of that kind of negotiation. In terms of the evaluation, I'll just answer both questions once. I would say that what I mentioned about the understanding not only what worked, but how things worked was in fact some of the most important results. And understanding the population results as well as the qualitative and community-based results, and also how it fit into the larger context of what was happening in the world. Not just what was happening to these people that we were interviewing, but how was the perception of what was going on in the bigger context, the drivers the kind of drivers that Lori was mentioned. So understanding that relationship was very helpful. And another thing was that we saw a bigger change among the most conservative group in our cohort, which was young boys in conservative areas. So to see that happen, a feminist organization, doing this, and see that the biggest gap was in these younger boys was actually quite interesting and made us kind of concentrate on that. So,
Lori? Sure. So I'll mention Kathleen's question around the results of the SASA trial. We had multiple primary outcomes. Some were around attitude, some were around behavior. We did have significant results on many of those, but the one on physical violence, we had a very large effect size. So we had an effect size of a 52% reduction in communities, but it was a clustered randomized trial. So that means it was we only had 4 clusters, and it was one cluster had a funky thing happen in it that we don't actually know what happened within that cluster. We don't know if there was other work being done. We've tried a lot to figure out what that was in that one cluster. But yeah, so even though, which is very hard to explain to staff and even myself as a non-researcher, but so the effect size was really significant, but because of the power of the study and the limited power of the study, that one outcome did not have significant results. But what we are feeling really encouraged about is that all of them are trending in the right direction. So we didn't have any of the outcomes kind of go in a direction that we did not hope for. So around refusal, women's right to refuse sex, the acceptability of violence, male sexual concurrency, which we were really surprised about, women who report violence receiving helpful responses. We had significance in many areas, but something happened in that cluster that is inexplicable. But we're trying to recognize that, okay, so even though that's the case, that doesn't mean we throw everything out, yeah? And that's why I think we're trying to frame that and talk about popularizing, right? Because when you talk to London School about that, they have a really different answer than me, which is probably better, but a lot of people don't understand it, and our own staff don't understand it. So what we're currently trying to do is figure out how to write that up in a way that really people can understand, and we can still see the value of the work, even if we haven't achieved what we had never even hoped for 52% reduction. And so we felt really great, and then there's this, slight technical issue. Yeah.
I guess I'll just add that real-world evaluation is messy, as we all know. And I'm glad that even though it was not statistically significant, that it's out there for people to see and consume and sort of learn from. Because I think otherwise we end up in a situation where only the positive things are highlighted. We never learn from our mistakes.
Thank you, which also was discussed the earlier panel, right? We need to know what works, but also what doesn't work, and we need to know how that is done. And so I think that concludes our second panel. I want to give a round of applause to the three panelists.